question that's up here that I think that we can kind of branch off of, which is, okay, yeah, so at the top. So the question is, what is the post-op time after which, for tendon bone ACL reconstruction, that maximal quad contraction is safe? Is there a risk of patellar fracture? And maybe a broader question is, how do specific surgical technique or a specific surgical case influence potential rehab considerations, maybe more broadly? And so, Dr. Jones, I don't know if you wanted to start with that?
Yeah, so any soft tissue graft, such as a hamstring, I like to load a little bit slower than, say, a BTB graft that has bone at the ends. The reason because of that is just because we know that graft incorporates a lot slower. That takes anywhere from about 6 to 12 weeks, whereas BTB, you're looking at 6 weeks. So there's a lot more room for slippage, graft slippage. We know that the way these things heal in the tunnel is that bone has to ingrow into the tendon. And so if we're not giving that enough time to happen and we start loading them too soon, then that graft will stretch out, and that's sort of why I have this implicit bias towards BTB autograft. For me, they feel better. The clinical outcomes would say otherwise, but that's just been my clinical experience and what I've sort of leaned towards because of that.
Just to clarify that, so when you say load, you're talking about putting stress, like an anterior shear stress on the graft, right? So with that though, I think there's still opportunity to work on quad strength and to create, I agree 100% to make sure that we're not putting abnormal stress on the graft. But with that, as rehab professionals, I think we want to make sure we're challenging the muscle to encourage strength return as quickly as possible in ways that we know are not going to put stress on the graft.